Yeah.
All right. Right, so we're here to talk about exercise and nutrition for healthy bones. Can everybody hear me?
Yes.
Okay. This is my disclosure. I do not have any financial conflicts of interest with the content of this presentation. And my objectives for today's talk are, we're going to talk about nutrition for good bone health. Why are food labels so important to read? What is calcium supplementation and things that we have found out with research by reading research about calcium supplementation. I did receive a few questions. I know this wasn't in our agenda about talking about exercise, but I did receive a few questions, and I'm going to explain more about why is it so important to talk about exercise when we talk about nutrition. So I will talk a little bit, not in much detail, but a little bit about type and intensity of exercise for good bone metabolism. And then I'm going to talk about some of the newer aspects of, or some of the modalities that are being used for bone building, since I received a few questions about new exercises and what's new in exercise. So I think it's one of my favorite topics to talk about, because we need to keep up with whatever new is coming out. So I'll be just talking in brief about these things, but as I said, I'll focus on nutrition for the most part of my presentation. So let's start with calcium. Why is calcium so important for us? What are the functions that calcium performs in the body? It is needed to maintain strong bones, of course. It's needed for a healthy structure of teeth. It's needed to maintain normal muscle function, normal nerve function, normal heart function, and normal blood clotting. So calcium is not just important for your bones, it's also really important for metabolism of your body and maintaining normal system of all organ functions in your body. And why is vitamin D needed? Vitamin D is needed for calcium absorption. So for calcium to be able to perform all of these functions that we just talked about, vitamin D is necessary. For your body to absorb calcium so it can perform the functions that we just talked about, vitamin D is necessary. And not only that, vitamin D also maintains muscle strength, it reduces risk of falls and fractures, and it regulates our immune system. Since I would like to just make a point here that since the pandemic and new research that has been done on COVID, as you may all already know, the importance of vitamin D, and it's been actually used in treating COVID in many places to boost the immune system and fight COVID. So regulation of immune system by vitamin D is big, and it's new in research. So let's look at how much calcium and vitamin D do you really need. Now, requirement of calcium and vitamin D is based upon your age. We can look at, you can later on look at the entire table and look at different age groups and how much the requirement is, but I'm going to focus on women 19 to 50 and men 19 to 70. So men between 19 to 70 years of age need 1,000 milligrams of calcium every day. And more than 71 years of age, men need about 1,200 milligrams of calcium per day. Women 19 to 50 need 1,000 milligrams of calcium per day, and women more than 51 years of age need 1,200 milligrams of calcium every day. And vitamin D, most of us fall in the category 1 to 70 years old, 600 international units or 15 micrograms of vitamin D is needed normally every day. If you are 71 years and older, you need about 800 international units or 20 micrograms of vitamin D every day. This vitamin D recommendation is for men and women alike. So that's how much vitamin D, that's how much calcium and vitamin D is needed every day. Now, when we talk about consuming calcium and vitamin D, what's recommended is to try and get most of this. I'm going to go back one slide and show you the normal values again. So what's needed for women, I'm going to stick to the group that I'm talking to right now. So most of us need about 1,200 milligrams of calcium every day. What is recommended is to try and get about 1,000 milligrams of that calcium, if possible, up to 1,200, but up to 1,000 milligrams of that calcium is recommended for you to get from food. So consume foods, which we are going to talk about later too, the sources of calcium. Consume foods that would give you calcium for up to 1,000 milligrams. And then you can get away with a supplement of 200 or 250 milligrams to make sure that you're getting a total of 1,000 to 1,200 milligrams per day. Now, how do you do that? How do you know if you're getting that much from food or not? That's when estimation of calcium and vitamin D intake per day comes into play. So when we talk about estimating your calcium consumption, there are two ways you can do it. Actually, both of the ways that I'm going to talk about, they're both needed for you to estimate or find an approximate value of calcium and vitamin D that you're consuming through your food every day. And that's when nutrition labels come into picture. So reading nutrition labels is extremely important for us. Per serving size, how much calcium and how much vitamin D you're consuming every day per food item is how you would get to estimating towards the end of the day, how much calcium did you actually consume from your food? Give me 1 second, ladies. Okay. So you can see I have a sample food label here that I'm trying to explain or just make it a little more, say, clear. When you look at the food label, per serving size of vitamin D and calcium content is usually mentioned on the food labels. On this one, you can see two red dots that I have there. That's where it says vitamin D about 2 micrograms per serving size, and calcium about 260 milligrams per serving size. So it's important to look at the serving size of the food item that you're consuming and how much calcium and vitamin D each serving size contains. So I usually tell people, our weekly diets don't really vary that much. We mostly consume the same type of foods during the week. Right? We have a routine. We mostly buy the same stuff. We eat the same kind of food. So it's very important for you to first estimate how much of calcium and vitamin D you are actually getting from your food. And the way you can do that is by logging your food. And you just may have to do this for 2 or 3 days in a row. Look at nutrition labels of every food item that you're consuming. Try to see how much calcium and vitamin D it has, put it all together. At the end of the day, add it all up to see how much of calcium and vitamin D you actually got from your food. You can, and some things like, you have a big, say, container of milk, you should be using measuring cups to measure, to make sure that per serving size, because when you're logging, you have to look at your serving size. So measuring cups are also of different types. There's a solid measuring cup and there's measuring cups for liquid. So make sure you're using the right kind of measuring cup and look at the nutrition label to see what the serving size is. For example, from a container of milk, if you're going to drink a cup of milk, make sure you measure it. Measure it, pour it into a measuring cup, and then try to drink it after that. And then you know for sure that you consumed 1 cup of milk, which may have between 400 to 600 milligrams of calcium. And then you log it. You log it, and at the end of the day, you put it all together to approximately find out how much calcium you got from your food. You can do the exact same thing for vitamin D also. So let's just review the steps of calculating your calcium consumption. First of all, know how much calcium you need each day. We just talked about that. Estimate the calcium in foods that you eat daily by looking at the nutrition labels, looking at the serving sizes, measuring your serving sizes and making sure that you're getting that and making sure that you write down and you log the amount of calcium and vitamin D that each serving size of that food item contains. And at the end of the day, add your daily consumed calcium and vitamin D to see if you actually met the requirement of 1,200 milligrams of calcium per day or not. Now, this just explains the same, but I'm going to stick to this slide as I talk. Now, at the end of the day, if you find out that you thought you were getting enough calcium, but when you really logged it, you found out, oh, I'm only getting about 800 milligrams a day. I'm not getting close to 1,000 milligrams. I thought I was, but after measurement, more often than not, this is what happens, that we find out we're not getting as much as we think we're getting. So what do you do at that time? At that time, you try to increase the consumption of calcium-rich food items in your diet. So in other words, most recent research is leaning towards consuming calcium-rich foods and calcium-fortified foods at a higher level than getting your calcium from supplements. So if you figure out after logging, after estimating that you're not getting enough calcium, you're getting less than 1,200, less than 1,000 milligrams of calcium, your first action should be to increase the consumption of calcium-rich foods and try to get all 1,200 milligrams from food each day. If that absolutely cannot happen, then you can supplement. And you supplement with a calcium supplement that just balances out. So for example, you got about 1,000 milligrams, or say you got about 800 milligrams from food, and you try to increase calcium rich foods, and you still are not you're not able to go any more than 800 milligrams, then you can supplement with a 400 milligram calcium or 450 milligram calcium so that you make up. You can't be consuming 1,000 milligram or 1,200 milligram calcium supplement while you're also consuming calcium rich foods. That's too much calcium, and too much calcium is not good for your body. So you always have to balance it out. If by estimation, you find out that you are in fact getting enough calcium from your food, you do not need to supplement. Okay, let's move on to vitamin D. Estimation of vitamin D is going to be exactly the same way: logging, looking at nutrition labels, and writing down how much vitamin D is present in each serving size. And then you estimate it exactly the way you estimate calcium. Most people need vitamin D supplementation, especially people who are living north of Atlanta. We don't really get that much exposure to sun, so most of us are low on vitamin D. The only way you can find out if you're low on vitamin D is through a blood test. So if you're really curious to know what your vitamin D levels are, every 6 months or once a year when you go for your blood work, most clinicians will check off vitamin D levels on there too. So keep a track of that and see where your vitamin D levels are. If you are within normal limits of vitamin D, then you within normal blood levels of vitamin D, then you do not need to supplement anything prescription strength. And I'm sure once your blood tests are done, and if your vitamin D is less than 20 nanograms per liter of your blood, which your primary care physician or your attending doctor will always advise you to take prescription strength vitamin D in that case. So, however, vitamin D supplementation is advised, but that's just general over-the-counter vitamin D. I would say still estimate and see if you're getting about 400 to 600 IUs of vitamin D from your food, then you do not need to supplement. But if you're not getting that, which is most likely the case because real sources of food with vitamin D are very few. So we have a lot of fortified food products that can give you calcium, but they don't match up to 400 to 600 international units per day. So you would have to supplement, but supplement with over-the-counter regular vitamin D. If you need anything more than that, the only way to find out is talk to your doctor, get a blood test, and see what your vitamin D levels are, and discuss with them if you need to take any prescription strength vitamin D. Now, We're talking about supplements, and this is a question that I get over and over again. How do you pick the right kind of supplement? So you want to pick a supplement. Now, I'm not going to talk about brands here, what brand is good, what we recommend, what we don't recommend, but we do talk about looking for some indications or some signs on a supplement bottle when you go to pick. So the 4 signs that you see here, these are the symbols to verify independent lab testing of these supplements. And what do these symbols mean? You have to look for these symbols on the bottle. If you see any one of them, it means that this particular supplement was properly manufactured. It actually contains the ingredients that are listed on the label. This particular supplement breaks down and is released into the body in a specified amount of time. I'm going to explain this a lot more in the coming slides about bioavailability and how a supplement breaks down in your body. And this sign, one of these signs, if you see on the bottle, it also means that this particular supplement does not contain any harmful levels of lead and other contaminants. Now, if you go to our website, www.nisofep.org, I'm going to share that as my last slide, so you'll all have that up for a while we are discussing. So you can copy that down. All of this information can be found on the website. So later on, if you want to access, you want pictures of these, you know, it's up for a short time right now, but you'll always have access to that. I can share that website later on with you. So these are independent lab testing symbols. So as far as picking a particular supplement is concerned, look for these symbols on the bottles. If you see any one of these symbols, that means that this is supposed to be a superior quality product that will be bioavailable and does actually contain the amount of calcium and vitamin D that is listed on the nutrition label for that supplement. Now, if you already have bought supplements, how to test, and your supplement does not contain any of the, or does not show any of these symbols on the bottle, what do you do? How do you check the efficacy of your supplement? So here's a simple test that you can actually do at home. So check your supplement by putting your supplement in lemon juice or vinegar. So lemon juice or vinegar, the chemical composition of lemon juice or vinegar comes really close to our digestive juices. So, so this is a test to see whether this particular supplement that you have is actually digested by your body and is available for absorption to your body or not. So you put the supplement in lemon juice or vinegar, let it sit for 30 minutes, keep stirring it here and there to make sure the idea is to see if this supplement dissolves completely in lemon juice or vinegar, if it sits in there for about 30 minutes. If it does completely dissolve, then it's a good supplement. Then that means that most of it is going to be digested in your stomach and will be available to your body for absorption. If it doesn't fully absorb, then it's most likely not going to be absorbed fully in your body also. So, so this is a simple test that you can do at home. I know I had received a few questions on this too. How can you tell if you have a good, supplement or not, if it's available to you or not? So this is a simple test. If you are going to buy supplements, I'm going to go back another slide. Try to look for these symbols. If you already have one and it does not have any of these symbols, try doing this test to see if the product that you're using is actually good or and is actually available for your body to absorb or not. Now, we talk about spreading out. So now you know that spreading out the consumption of calcium throughout the day. You know that you need about 1,200 milligrams of calcium every day. Now, taking all of that 1,200 calcium a day is not good because your body can absorb only about 500 to 600 milligrams at a time. Anything more than that is just eliminated. It just cannot be absorbed by your body. So make sure you break down the consumption of calcium throughout the day, spread it out. I'm going to read these points. We talked about some of them already. Calcium from food first, and we just talked about it. that try to get about most of the calcium that you need, 1,000 to 1,200 milligrams, try to consume all of it or most of it from food. So that should be your first goal. Try to get most of your calcium from food so you don't fully depend on the supplements. No more than 600 milligrams of calcium in one meal, because your body really cannot absorb any more than that. Your body's capacity to absorb calcium is anywhere between 500 to 600 milligrams at a time. So you spread out the calcium consumption throughout the day, no more than 500 to 600 milligrams in a meal. Also, try not to consume more than what's recommended for your age group. If you're recommended only 1,200 milligrams, that's all you should be taking, no more than that. So you shouldn't be, thinking the more the better might be good for my bones is not going to work, because too much calcium is not good for your body. It's a lot of work for your kidneys. It's not good for your heart. So make sure that you are not exceeding the recommended daily allowance of calcium per day. If your estimation shows less calcium and vitamin D consumption per day, supplements may be needed, which means I'm gonna actually elaborate on this. I told that before too, that if by your estimation, you find out that you're in fact not taking about 1,200 milligrams of calcium, try to get most of it from food. And if upon trying also, you're not getting up to 1,000 or 1,200 milligrams, then you pick a supplement. Otherwise, supplementation is not encouraged and it's not necessary if you're getting about 1,200 milligrams from your food. And the same applies for vitamin D too. If your estimation shows that you're consuming less than vitamin D, less than what's recommended vitamin D per day, then you need to supplement. About supplementation, this is specific for vitamin D, how much vitamin D you should be supplementing with. This is a discussion you should initiate with your healthcare provider. You should have this discussion with either your endocrinologist, either your gynecologist, or your primary care physician, whoever you are, whichever specialist you are seeing for osteoporosis. You should have this discussion with them to find out if you need any supplementation from vitamin D and what should be the strength of that supplementation. Yeah, so that's what you need to discuss, whether you're going to get away with over the counter or you need prescription supplementation of vitamin D. Most of the time, your provider will send you for a blood test to see your vitamin D levels, and then based upon what they find, they will decide whether they will decide to recommend either over the counter or prescription vitamin D. Now, points to remember about calcium supplementation. We talked about picking the right kind of supplement by looking at the quality. Then we talked about not consuming more than 600 milligrams at a time. Also, there are two different types of calcium compounds that are available: calcium citrate and calcium carbonate. I know that I received a few questions on this also, which one is better. So what's recommended is calcium citrate. Calcium carbonate sometimes does not get fully absorbed in the body. So calcium citrate is the compound of choice. To make sure that all of it or most of it is absorbed in your body, you should always pick calcium citrate. Calcium supplements are available in liquid form, powder, chewable, tablet form. That all is based on your preference. It really is based on your preference, what type of calcium supplement you prefer. It is best taken with food so that it's maximally absorbed in your body. So I would like to make a point over here too about consuming a calcium supplement with food. Now, the reason why it's recommended you take it with food is so that it's fully absorbed in your body. Now, make sure you are taking your calcium supplement with a low calcium meal. Because remember, if you're taking about 500 milligrams of calcium supplement with a meal that is also high in calcium, your body is just going to work on absorbing that calcium from the meal, and it's going to fully discard the calcium supplement. Does it make sense? Because your body can only absorb 500 to 600 milligrams at a time. And not only that, your body prefers calcium from food. So if you're taking calcium supplement once a day, just an example, and it's about 500 milligrams, and you're taking it with a high calcium meal, your body is just going to discard it. It's not going to absorb it. Here you think that you had a full meal, full of, calcium rich meal along with a 500 milligram calcium supplement, your body is just going to discard it, and it's just going to end up absorbing calcium from the meal that you consumed. So try to take calcium supplements if you're supplementing with food, but not with a high calcium meal. Read the supplement and food label for serving sizes. We talked about this before, and I just described this below. Best taken with a low calcium meal. And calcium and vitamin D go together. We talked about this. It doesn't matter how much calcium you put in. If you're low in vitamin D, your body is just not going to be able to absorb it. So for your body to absorb the calcium, you have to make sure that you have normal levels of vitamin D in your body, because vitamin D is necessary for absorption of calcium. Now, these are the pillars of bone health. I said that I would talk a little bit about exercise because I feel that it is extremely important for us to understand that nutrition and exercise go together. And for you to have a healthy and strong skeleton, you need good nutrition, you need the right kind of exercise, and both of these together are necessary, not just required, they're necessary for normal bone metabolism. So for the nutrition that you're putting in your body, for that to be absorbed, the right kind of physical activity is necessary when it comes to the skeleton. At the same time, exercise is not going to give you the effect that you want from it unless you have the right kind of nutrition. So in a way, exercise and nutrition are interdependent on each other when it comes to osteoporosis or talking about bone metabolism and bone health. So some of the most common questions that come up when we talk about exercise and bone health are, what type of exercise should I be doing? How many times or how often should I do these exercises? And how long should I exercise for to get the benefits that I'm looking for? And how hard should my exercises be? These are some of the most common questions that come up. The type of exercise, the frequency of exercise, the duration of exercise, and the intensity of exercise. So all of these have to be right for your body to be able to assimilate the nutrition, the supplementation that you're giving it for a healthy and strong skeleton. So here's the answer. The type of exercise. All of these exercises are needed. You need aerobic activity, you need strength training, you need balance and flexibility. All of them are needed. All of these components make up your exercise program for osteoporosis. The frequency of aerobic activity could be 5 to 7 days a week for about 20 to 30 minutes. And the intensity is moderate. If you look at the last column that I have, which says intensity, all of those intensities are moderate. Now, moderate intensity is chosen and is recommended for people with osteoporosis to reduce the risk of injury. So the kind of exercise program that's recommended is moderate intensity, but long duration, so that your body can so that you can get the desired effects of bone strengthening and bone stimulation. So moderate intensity and long duration. And all of these components are needed. You need aerobic exercise, you need strengthening, you need balance and flexibility. Any one of them, if it's missing, you're not following a complete program for osteoporosis. So frequency of strength training, what's recommended is 2 to 3 times a week for about 20 to 30 minutes. Balance and flexibility can also be done 5 to 7 times a week, 20 to 30 minutes, and again, moderate intensity. So these are the general recommendations for people with osteoporosis. However, if someone has osteoporosis, it doesn't mean that they don't have other physical issues with their body. Oftentimes, when I'm working with people with osteoporosis and devising an exercise program, the basic principles are these that I'm discussing with you. But there could be something else that we have to keep in mind. For example, I'll just give you a simple example of knee pain. And knee pain could be because of anything. It's a weight-bearing joint. It could be arthritis. It could be a ligament injury. It could be anything. So a simple example of a person who has osteoporosis and also has knee pain. So a lot of these weight-bearing exercises that we talk about may not work for this person because they might aggravate their knee pain. They might cause these, for example, walking on a treadmill, jogging, or using aerobic step exercises. So things like that can increase their pain. So these are your basic guidelines. Take these, but you will have to cater the program to your abilities. That's why we recommend moderate intensity exercise program and not a high intensity exercise program for strength training, so that you don't aggravate your pre-existing conditions. At the same time, you're able to continue with the exercises and get the benefits that you're looking for. Now, when we talked about moderate intensity, this is a nice scale that I use with people a lot, which helps them determine what is moderate intensity. What do you mean by moderate intensity? So this is a scale, we call this a BORG'S scale. What this scale does is it measures your perception, a person's perception of the effort that they are putting in to accomplish an activity. So the effort is measured from least effort, number 6, to maximum effort, number 20. And these numbers are, these numbers have value, these numbers have descriptions like, you can look at number 7, it means very, very light. Number 9, very light, and so on. So when you're doing a strength exercise, for example, you're working with exercise bands, just an example. So what is a moderate intensity exercise band? How hard should that resistance be for me? This scale really puts you in charge as a person who's doing the exercises. So this is a good tool for you to use. Look at this scale, and I can email this scale to Shelley later on, and she can share it with all of you. It's a very powerful tool that I always use. So you want to be at anywhere between number 12 to 13, which means that the resistance that you're working against should feel like somewhat hard to work with. And that's depicted as a moderate resistance, and it's a safer resistance for you to work with when you have osteoporosis. Okay, some other things, some movement precautions that you should keep in mind: bending forward. All exercises that make you bend forward and round your lower back should be avoided. Lifting should be performed with right body mechanics. Lift at your hips and knees, and lift stuff. Lifting is a functional activity, and you cannot eliminate it from your daily activities. So make sure that you bend and lift at your hips and knees, kind of a squat lift position, rather than bending forward and rounding your lower back and trying to lift something off of the floor. Twisting and extreme spinal rotation. Twisting would be turning your body side to side where your legs are not moving. So it's mostly your upper body twisting from side to side. A lot of exercises require that movement. Those exercises are not for you. So you shouldn't be doing any exercises that require you to twist your trunk, because they are associated with increased incidence of vertebral fractures. So avoid those exercises. And extreme side bending is associated with rib fractures in people with osteoporosis. So extreme side bending would be bending to your side, right and left. So any exercise that requires you to do that should also be avoided. Now, if any of you are following any group classes where you do these exercises, just take these principles and apply to whatever kind of exercise you're doing. And if you are working with an instructor, you can always ask them to show you modified positions to make sure that you are not putting yourself at risk for injury. Now, I did receive some questions about what are your newer, newer things in exercise that you're using, newer modalities in exercise you're using, and have exercise recommendations changed in the last few years? Yes, exercise recommendations for osteoporosis have changed as new research is coming out. And these are two modalities that we use in physical therapy, and I use them every day on patients with osteoporosis. One of them is the vibration plate, which has an astounding research on increasing bone metabolism and bone density. And the newest, and I can share this research with you guys. I can email Shelley some articles that have just recently come out. Vibration plate has been around for many, many years. So I don't know if I'm going to find any new research on vibration plate, but it's an established modality that we use for osteoporosis in clinics. Blood flow restriction cuffs, they are a newer modality, all right, because they have just not been around for very long. I myself got certified in use of blood flow restriction cuffs in 2019. And since then I've been using them on patients with osteoporosis. And new studies are coming out every day, and I'll be happy to share some of the new studies on blood flow restriction cuffs with Shelley, and she can share it with the group. On how the latest study that I read, it came out in 2020. And this was performed on postmenopausal women, the use of blood flow restriction cuffs. And then what they did was, after a regimen of BFR cuffs, they measured bone markers in the blood, and they did repeat bone density tests, and everything went up. Bone density went up after about 6 months of using BFR cuffs. And blood bone markers immediately went up in about a month of using blood flow restriction cuffs. I'll be happy to share this study with you, Shelley, so that you can forward it to the group. Yeah, so this is also one of the newer modalities that we use. And once people, once people are able to use it, this modality is good that you can purchase it for home use too, once you've learned it from your therapist. So if any of you are going to physical therapists for osteoporosis or any other issues, you should have a discussion with them and inquire about these blood flow restriction cuffs and see if they are available, and you can be a candidate for using them. So to sum it all up, lifestyle and nutrition for bone health. These are the key points to remember. Physical activity, the right kind of physical activity is really important. I know some of you had asked me that we've been physically very active. So you have to make sure that what's new is to make sure you're doing the right kind of physical activity, the right kind of exercises that we talked about in every component of exercise. There should be aerobic activity, there should be balance exercises, there should be strength training. So all components should be done together at the right kind of frequency. A nutrient-rich diet, and not only a nutrient-rich diet, but a calcium and vitamin D rich diet. Diet that gives you recommended amount of calcium and vitamin D every day and reduces the need of calcium and calcium supplementation. That's the kind of diet that's recommended. Maintenance of a healthy body weight, looking at your daily calcium intake and comparing it with your requirement and making sure that you are getting enough of it from food. And same thing goes for your vitamin D requirements. Fall prevention strategies, which balance and strengthening is going to improve your, or reduce your chances of falls. But it's there's a lot of programs out there, like there's a Matter of Balance program that's run in New York State. I'm sure it's available to other states too, to improve or reduce the risk of falling. Smoking and alcohol should be reduced because both of them, smoking causes, what was I going to say? So smoking causes toxicity in osteoclasts and osteoblasts. So these are two things that should be avoided. So these are some of the lifestyle changes for good bone health that you can adopt. And that's it for my presentation. This is the website that you can go on. That's the New York State Osteoporosis Prevention and Education Program website. And the email, info@nisopep.org. If you have any questions ongoing, you can always email us, call us, and we will try to give you as much education as we can based on latest research. Now, I know we're running a little late, are we? No, we're good.
No, we're good.
We're good. We're good. Okay. So I printed out the list of questions that Shelley had sent me. And as I mentioned before, most of them were already addressed in the presentation. I've highlighted some of them, and if I missed something, please feel free to ask.
Payal,
I have one question that.
Excuse me, Payal.
Yes.
Do you want to let that screen go so we can bring